Welcome to UWITV. I'm your host, Deveron Bruce. And today in studio we have a very special guest, Mr. Dale Trotman. Dale is the founder and CEO of MedRegis, a health technology company in Barbados that has an expansion across the region, and I would say even maybe across the globe. And today in studio we're going to have a conversation about the health technology sector in Barbados in the region and how do we bring that sector to a more modern era when it comes to technology and health. So Dale, thank you for joining us.
I'm glad to be here, Devron. Thanks for reaching out to me. Well, MedRegis is a health technology company. Our focus, as Devron said, is Caribbean, beat home drums first. And with our solutions, our main solution is an electronic health record for doctor offices and clinics. Additionally, we signed a partnership with Doxy.me, and they're global telehealth leaders. And with this partnership, we are looking at bringing telehealth throughout the Caribbean. And when we talk about telehealth, Devron, telehealth would be the umbrella. You're talking about telemedicine will fall under that, and that would be virtual appointments between doctor and patient. You have telepharmacy as well, which should be remote pharmaceutical care. And telepharmacy can reach a point where you have remote dispensing sites and the pharmacy is connected remotely and you're dispensing medication in underserved and rural areas. It can reach that point. And you're also talking about other areas like education and training of medical students, and as advanced as a doctor remotely connecting into a surgery to guide the process.
Excellent. This is exciting stuff, and thank you for that introduction so very much. Now, to our next question, what were some of the underlying reasons for you to head in this direction? Do you have a background, for instance, in health? Do you have a background in technology and communications, or what? Why this area?
I don't have a background in medicine. I have a background in technology. And I always say that even when I'm mentoring young people, once you have a mind, you can create anything. So MedRegis started when he received an email from the UWITV about a competition called the Caribbean Innovation Challenge. I always wanted to be an entrepreneur, and I was looking at different ideas. And the word innovation, that really captured me. So I started looking at various sectors within the Caribbean that required innovation. And healthcare was the most interesting because from check-in to check-out, 9 out of 10 doctors still use paper. And that is not efficient. We need to move forward from paper. I saw that for myself within my appointments. I remember where the doctor even turned the notes and asked me, could you understand what your doctor wrote here? I've had situations with missing files, missing notes that somehow got wet and the ink ran and you can't understand. So all of that is problems that we need to solve and move away from, especially in the 21st century, because we want the Caribbean to be seen as a 21st century region.
Excellent, and I think that's a very important point that persons don't really think about, the damage that can come from the analog system and the fact that this is very important information that you must have at your fingertips. So beyond issues such as the damage that a paper can have, for instance, running ink, what other benefits do you have when you have that technological approach to healthcare and records in particular? So from the doctor's perspective, from the clinic's perspective, from the client's perspective, what other benefits would you say exist?
Look, for example, data structure. When you have a medical note that is thick, 50 pages or 40 pages, how are you going to effectively peruse that to find crucial information that can help guide your current appointment? It's going to be difficult. And not only that it's going to be difficult, it's almost impossible because if you're running a clinic, you're going to have multiple appointments in a day. If you do that, if you sit down and go through a paper-based file from beginning to end, you would be running a 24-hour clinic. Mm-hmm. So when you're talking about electronic health records, you're looking at structuring the data in an efficient way that you can see at a glance, these were the labs, these were the allergies, medications, and whatever other area you need to preview. And it's much more efficient, and you can view this information at a glance quickly and make your decisions on the go as a doctor. When you look at the patient, because you were speaking about the patient, when you look at the patient, I want to draw some scenarios to you. And these are scenarios that I have experienced. We have a mother, right? She raised the money for the appointment, but she doesn't have the money for the bus fare. She now has to choose now between sacrificing something else, probably like food for the child or so on, to get to that appointment, or leave the appointment to another time and hope the child gets better. And that's a real situation that happens. You have a father, he was sick this week, he missed hours of work, and the doctor calls. He's off Saturday and Sunday. He's hoping that the doctor is going to tell him, well, bring the child on Saturday or bring the child on Sunday. But the doctor says, I can only do the appointment on Friday. So now he's in a situation now where he has to decide, do I make less money this week and not able to buy the school clothes, the books, the shoes for my child and take the child to the hospital? Or do I take the child to the hospital and forego those things to a later point? And these are situations that are real for Caribbean people, and these are situations that telemedicine can solve. These are the situations is what I want to see solved in the Caribbean, because MedRegis, for me, is not just about profit. I have a social responsibility onto my people in the Caribbean to provide solutions that are effective and efficient.
Excellent. So effective and efficient, and it's just not just for the, as you said, the healthcare sector, but also the individual, and really prioritizing the individual and the experience that the individual has when it comes to customer relations and when it comes to really the service that's delivered to the client. So I think that's excellent. It's people-centered as well as business-centered, and that actually makes a lot of sense for a young entrepreneur like yourself.
Thank you.
Now, I would say, I don't want to say practical terms, but what are the benefits, for instance, costs for a clinic? What are the benefits of moving to a digitized approach to healthcare? One may argue that a paper-based model is cheaper, but should we maybe look at it more holistically as a system?
Well, look at it how professional and how important your business is to you as a doctor or nurse practitioner. For me, if I am a doctor, I do not want to be using paper, because I don't want that you come in, I can't find your file. That's a bad look for me. You may not come back. You may be a patient that is going to spend $2,000 this year in my clinic. That's $2,000 I just lost because I created a problem for you. So yes, the paper may be cheaper, but the problems from paper will be more expensive for you than an electronic health record. So it always is best to run a business as efficient as possible. You want your clinics, sorry, not your clinics, you want your patients, when they enter your facility, they can see the improvements you're making towards their healthcare and communicating those improvements. We have an electronic health record. We're entering your data digitally. We are not going to be using paper anymore for your records. We are looking to move away from these problems. We are also going to be looking at patient portals, where the patient can book appointments via the portal, where the patient can see certain aspects of their medical information via the portal. And all of these things are important because we have to empower patients in healthcare. No more, we don't want the patient on the back seat anymore. We want the patient to step up front. I think patient portals would be a good way to streamline care between patient and doctor.
So excellent. So MedRegis, in essence, would give a competitive edge, I would say, towards an individual who may not be using it, for instance, because patients then feel as though they're prioritized in the system and they have, for instance, an approach that ensures efficiency and effectiveness when it comes to their service. Now, you mentioned portals, for instance. I know sometimes that may scare persons when it comes to that kind of discussion. You start thinking privacy, for instance, and issues of data privacy and those kind of things. What are any concerns regarding data privacy from your company?
We always strive to use the highest standards of data security for our solutions. Healthcare and health technology must be synonymous with security. There's no two ways about that. There's no F's about that. It must be synonymous with security. So we always strive to use the best digital security possible. Our partnership with .cme, they're fully HIPAA compliant as well, because they're global leaders in telehealth. So they're going to be at a very high standard as well. So when we look for partnerships, we always look for high-level partnerships that can bring value to the Caribbean. And I think we are moving in the right direction. Health technology, I enjoy it. It is not easy because there's a lot you have to understand, a lot you have to do, but that's part of being an entrepreneur in general, regardless of what the field is. And it's been a tremendous journey, just building a community of doctors, pharmacists, nurses, nurse practitioners throughout the region. That is what I want to do, because the way for us to move forward is to come together as a community, problem solve, and build out solutions for the Caribbean.
That is excellent. So persons will not have any concerns regarding data privacy because everything is secure and you're using replicable sources and partners in your approach.
Exactly.
So you made mention, for instance, of pediatrics, for instance, and clients and clinics rather, and various aspects of the healthcare sector. Those are, by and large, private entities. What then about the public? I assume then you also focus on public health?
Yes, for sure, because you cannot be talking about Caribbean healthcare and not talk about public healthcare. That is a huge part of healthcare, any part of the world. When we're talking about building a community, it has to include public healthcare. And MedRegis is building a community of ministers of health, their PSs, and the entire public healthcare sector throughout the region. Because, especially with our telemedicine solution, we can see how telemedicine can hugely impact rural and underserved areas within the Caribbean. And that is going to be an important aspect of improving patient outcomes and the continuity of care regionally.
Excellent. You mentioned, for instance, the use of an app. In practical terms, what would it look like for me had I been, let's say, unwell and I wanted to interact with my healthcare professional? What practical terms, how does it look using a MedRegis platform, for instance?
As it relates to the patient portal, we haven't developed that as yet, but that is part of our plans because we need to empower the patients in the healthcare process. That is crucial in terms of growing the healthcare ecosystem regionally. So when we're talking about patient portals, we're looking at appointments. We're looking at where you can schedule appointments with your doctor. We're looking at you having access to pertinent medical information, because you may get in an accident. I may not be able to access your doctor. You may be able to utilize your patient portal to provide me that will be giving you care information that is crucial. Medications, which medications have interactions if you give a person the wrong medication. All of those things will be important in improving healthcare. So a patient portal would be very important from a patient and also the medical professional's perspective.
So successes thus far, MedRegis, what were some of the successes that you've had this far? What are some of the surprises, positive surprises I would say, in operating in Barbados and the wider region?
I would say our main success would be the community we are building across the region, because health technology is new to this region. We are not widely using health technology in healthcare in the region. So it is going to be important that we involve all stakeholders to understand what they need and develop a solution that fits those needs. Because when you look at the US, one of the major problems with electronic health records in the US is that they're too cumbersome, to the point that they're creating physician burnout. Stanford Medicine did research on this in conjunction with the Harris Poll, and it shows that doctors are saying that electronic records are too cumbersome and that their interfaces need improving. Again, I have a social responsibility to the Caribbean. I do not want to replicate those problems into the Caribbean. So it is not just about profit. If it was just about profit for MedRegis, we would just create an electronic health record, market it, show the doctors, try to get as much people on board, but that would be wrong for me to do, because I would then be recreating a problem that I already know exists. So our approach is to develop a solution that is as efficient as possible so we can streamline care in the Caribbean. And if you are not doing this as a health tech company in the Caribbean, you are not a company for the Caribbean. You have to be focused on what is important and what is needed to drive healthcare upwards within this region.
Understood. It's really about understanding the cultural realities in your society, and as you said, not replicating the problems that others are having, but finding solutions before you even implement your own solutions as well too. So interestingly enough, I know young entrepreneurs and entrepreneurs in general in the region may find themselves up against the wall sometimes. They encounter hurdles, legislative hurdles, maybe financial hurdles, capital, expertise. What difficulties as an entrepreneur and the founder and CEO of MedRegis that you have encountered thus far?
I would say I've been blessed in terms of funding, support, and the access to resources, not only regionally but internationally, being part of different organizations winning business competitions, and going out there and networking and grinding as hard as possible. And that is an important aspect for any entrepreneur, going out there and just putting your all into meeting people, understanding what's out there, understanding who is out there, and just building that network so that when you come to a point now, it's all about partnerships, because no one company can solve all the problems in health technology. You're going to have to look at what other companies are doing best and incorporate that into what you're doing. In terms of problems, I think two of the biggest issues, correct contact information, up to date and correct contact information, because you want to reach out to certain people, you want to find certain people, but sometimes the information is incorrect, and I'm talking about is being incorrect for years, and you don't know how to reach these persons. So I think that's the area we fall down on, which is having information incorrect for too long of a period. Not only that, in terms of statistics is huge for any company. Like, for example, I would love to know how many clinics are in Barbados, how many clinics are in St. Philip, how many of those clinics in St. Philip are pediatrics, or general practice, family physician. That is important, because then when they understand the environment, it helps chart the path forward on what our roadmap will look like.
Smart data in essence, so now you're breaking down where things are, what they provide, and that information is definitely useful for any person who wants to operate within that space. So you made mention of statistics and the centralization of data. So I'm assuming that MedRegis is also specializing in centralizing that data?
Yes, we are.
Excellent. So for instance, if someone wants access to that centralized platform or portal, for instance, how would that be operationalized?
I'm glad you asked that. One of the most important things about health technology, you're going to hear a word called interoperability, where different systems can interconnect with each other. And I think that is a very important path for us to look at in the Caribbean. It is a problem that is giving other areas headaches, because a lot of things that were supposed to be done first were done last. We in the Caribbean, we don't have that problem, because we are mostly paper-based. We do use health technology, but it's nowhere near to the extent of the US or Europe. We have the opportunity to look at interoperability and create systems that interconnect, because, as I said, no one company can solve all the problems. But if you have a system where I'm electronic health record, say you come now, Devon, and create a wearables health technology company where you're gathering certain data like BMI, fat percentage, and so on, that your system could sync it right into mine. That as a doctor now, when you take that information, it syncs directly into mine via API or however it is set up, once it is efficient and secure. That is important information straight from the patient, straight into the medical profile. And that can be a reality. But again, it is going to take stakeholders to realize where we need to go and chart that path forward with companies like MedRegis.
That is actually extremely interesting, that BMI example you used, for instance, because then I would assume that had I been a doctor, I would be able to check on the health of a patient. Let's say that they put on 10 pounds in a month, for instance, and be able to just have a preemptive approach to medicine. So I think that's an excellent idea.
And you realize what that is? That is being done remotely.
Yes.
You don't even have to enter into the doctor's office. You can stand up on a scale. There are some very advanced smart scales. That information is recorded and goes straight into electronic health record. That is where I want us to reach.
That is quite brilliant. So as we move on to the next question, we were talking about solution finding, and fundamentally you are a solution finder as an entrepreneur. I know that the climate in the Caribbean can be problematic for entrepreneurs, as we were just discussing. So what recommendations, for instance, would you have, like legislative recommendations, bureaucratic recommendations, for instance, maybe funding that could, just improve on the environment, the general environment that could help a company like yourself?
Well, from a legal standpoint, we have to look at, finding a way to move away from paper-based medical records, because paper-based medical records really adds no value to healthcare. If we have a situation where we have a flood or something happens that the records are destroyed, that's it. There's nothing after that. If I set up a computer here, we set up a clinic in this studio here now, and we start entering people's medical information from students from UWI. and for example, the roof blow off, and a whole set of rain come in and the system is destroyed. All of it is in the cloud.
Yes.
So that doesn't create a problem for us. It will create a problem that we have to buy back the equipment, but it doesn't create a problem where we have to now try to re-enter or attain the information again.
And that is important because as a small island developing state like Barbados, and the region in general, we're subject to natural disasters that quite frankly could, as you said, erase the analog system. If a paper is destroyed, it's destroyed. If there's a fire, it's gone permanently. So I think that that's actually quite smart to really place it into the context of that vulnerability as it relates to climate change, for instance, flooding and those various things, because I recognize that persons tend to store paper in basements, if you get what I mean, and on the floors, for instance. So I think is an excellent point to bring forward, that it really brings security as well to your information.
And I say that because I have seen situations where whole rows of medical files are stick together because they were wet. So I've actually seen this, so that's why I can speak on it, because it is not a situation you want to find yourself in the 21st century. And when you're talking about medical tourism, you can't talk about medical tourism in the 21st century and you are using paper. We need to evolve, because when you evolve the healthcare ecosystem, you're talking about electronic prescribing. You're talking about e-labs, where instead of Chem's Cream or any other company here sending back paper-based results, you could send it straight to the system. The doctor will see it. You could send it straight to the patient portal. Patient will see it. All of that is where we need to move forward. You can't do that with paper. Paper actually bogs down the system a lot. It bogs down. It doesn't streamline anything. And again, I would love to see our entire region moving forward with health technology, because we, not just me as the vendor, but also the doctors, the ministers of health, we all have a responsibility to every single citizen of this community. And that is to provide effective and efficient healthcare.
That is an excellent point you mentioned with the medical tourism, for instance. It really broadens your market. You're not just focusing on a very localized market. It allows you now to focus on a broader market. You can actually get persons in, and that obviously grows business as well too. So the benefits are just putting up on each other. So
I like how you put that.
So I believe in 2019 you won, I think it's the Entrepreneurship the Entrepreneurship World Cup. That was a handful. Entrepreneurship World Cup. Could you tell our audience a bit about that experience?
That was a great experience. I actually won the Barbados leg, and I actually made it into the top 100 within the entire globe, the top 100, which in my opinion was a great achievement. And events like this are very important because of the networking possibilities, because you're in the Middle East, you're meeting people that are solving unique problems in unique ways, I should say. You're meeting with people from Africa, Middle East, Asia, Europe. So you're diverse in your communication and in your learning. And all of that helps when you come back to the Caribbean, because you have a different view of things. Also, the part of the event was about pitching, and I love pitching. I love pitching my startup. I love talking about my startup. I love hearing other people pitch, because you can learn from other persons. And I always go into these situations as a student. I don't ever go into it as the teacher. I always want to be learning. I always want to be moving forward as a person, and I always want to be bringing people with me and moving forward as well. One of the best parts of being in Saudi Arabia, we were in two cities, Jeddah, which is a more traditional city, and Riyadh, which is more modern. And in Jeddah, we were at the Coast University, which is a premier technological university in the Middle East. And if I had to transport you there right now, just zoom and zap, and you're there, you would think that you're in a city. You wouldn't think that it is a university. It looks like you're in a mini city. You have everything set up, housing. It's really nice. It's like UV multiplied by 10. But it's really nice, and you get to see different levels of technology and the way things are integrated. And I always tell entrepreneurs, if you get the opportunity, or anyone, to travel, don't just go to the US. Don't just go to England. Explore other areas and learn and see what they're doing, because you may just get the next bright idea that could come and solve a problem within the Caribbean. It might not be the same exact idea, but ideas can evolve out of ideas.
Yes, certainly. And I think that networking that you mentioned is extremely important.
Mm-hmm.
You learn the best practices, you learn the best and the worst of what you should and should not be doing. And as you said, really tweaking to fit into your cultural context. So we could imagine that a circumstance like that was extremely beneficial to you.
Mm-hmm.
Now, you mentioned this Entrepreneurship World Cup. How competitive is the field of tech health in the Caribbean?
The field of tech health is new to the Caribbean, so it's not that competitive. There are not a whole set of players solving a whole set of problems. And that is okay with me as well. It is new, so I think it allows us to look at things from a fresh perspective and create solutions that are unique and that would improve the environment. But I would say this to any other health technology company: efficiency has to be part of your goals. Your goal, your mission, your vision. It has to be about efficiency, because I do not want to see problems in the US replicated here, because then you have to spend money to solve those problems. And then what sense is that? So I know that this might be advice to my competition, but it isn't really about that. It's really about the community, the health technology, healthcare community regionally. So I would love to see we focus on efficiency. And if we could partner, let us partner. Because again, one company cannot solve all the problems. Healthcare is vast. There's a lot of different areas of healthcare. There's no one company that could come and do every single thing. You have to specialize in one thing or two things, get it right, and look to create those synergies and partnerships throughout. So I have no problem with that. Our motto is striving for digital excellence in healthcare, and that is what we put out front with every single thing we do. Even when you look at our partnerships with DocC are global leaders in telemedicine, telehealth, and that is a synergy that can create real value within the Caribbean and even beyond, because as MedRegis grows, I want to expand into other developing regions, because again, it's about social responsibility. We need to look at other regions that are lacking health technology, lacking in certain areas in healthcare, and see how we can grow beyond the Caribbean and also help others as well.
Interesting. You spoke about those synergies, and you also spoke about the fact that you're giving some advice to your competitors, for instance. But in synergies, I think those are important. But what gives MedRegis the cutting edge? Is it the fact that you're almost the first one out of the gate, so to speak? What is your cutting edge, you would say?
I would say our cutting edge, our unfair advantage would be the partnerships we have in terms of like with DocC. Because for example, they're vastly experienced in health technology. The person that I work with, Varun Aurora, he is, I would say, in my opinion, a health technology guru. He understands certain aspects of health technology. He's done things in Asia, like in India and so on, where he understands where the problems are in regions that healthcare may not be as advanced as the US, how to solve these problems. So I think the unfair advantage for us is the partnership we have with DocC, because they are a multi-million-dollar company in health technology. You don't reach those feats without solving serious problems or understanding the market. And partnerships like that are not going to be a dime a dozen within the Caribbean. So I think that is where our added value is. And to reiterate, our added value also will come from our focus on efficiency. Because when you think about it, doctors are going to want to integrate technology in their professional lives the same way technology is integrated into their personal lives. You want to you want to be using technology in your work life that adds value, that it doesn't feel like a burden. The same way you may, when we finish this interview, you may pick up your phone and go on Instagram, search, you have to search. You may go up on QuickBooks if you have a business, look through your accounts, sort out the stuff you have to sort out, and that feels like a part of you. I want doctors to feel like the technology is a part of them. And that, I think, is what is going to move MedRegis to the top. And at the end of the day, in 5 years, I want MedRegis to be seen as the company, not one of the companies, but the company that is moving healthcare forward within the region and looking to expand into other developing regions.
I think that's extremely important. So it's not just a situation where you're throwing spaghetti at the wall and hoping that it sticks. You actually have partners who are experienced in the field and have produced solutions across the globe. You're really filtering that system down to give you that competitive edge and advantage. So I think that partnership is important, and it will be added value to the region as well. I'm glad you made mention of the 5-year mark, so to speak. If you had a magic wand, all your problems were removed, any difficulties that you have, any difficulties that the region may have regarding technology and health, what would your company look like in 5 years, and what would telehealth look like in 5 years regionally?
You're sick, you get up, you go on your patient portal, you book your appointment with your doctor. The doctor realizes it is an appointment that could be done via telemedicine. You connect with your doctor from your home or from at your workplace if you have a private area to share. He sends your prescription electronically to the clinic. You may have to come in to do some blood work. Those results go off the lab electronically. They're returned to your patient portal and also to the doctor's end as well electronically. Everybody's interconnected. Healthcare is improving. Patient outcomes is improving. Continuity of care is improving. We have remote dispensing sites for pharmacies in underserved and rural areas. So now we are giving people that are at a disadvantage an advantage. We are moving healthcare forward in every single aspect. That is where I want MedRegis to be moving towards. And all of those problems we are not going to solve. It's about partnerships as well. Because I'm not going to say we're going to sit down and create all of those solutions. That wouldn't be practical. This is why I want to see young entrepreneurs in this region coming with ideas, getting the support for the ideas, and moving forward to build this region into a powerhouse globally. Because we talk about tourism, we talk about medical tourism as well. If you're going to talk about tourism, you have to build up that infrastructure. That people can see, well, these people are serious. I can go here and I can provide the information I need to provide because I may have diabetes, and it's an effective rollout within the Caribbean. That is where we want to reach.
Excellent. So the fundamentals still remain patient care and really just, ensuring that persons who are most vulnerable have access and are able to just improve their quality of life. So thank you so much for joining us, Jill. It's been an extremely insightful and important discussion that the audience, I'm sure, would very much enjoy. So I am Devron Bruce, and in studio we've had Mr. Dale Trotman, who is the founder and CEO of MedRegis, a regional company that, quite frankly, has been doing quite a bit of extremely good work to improve the quality of health that persons have access to in the region. We've discussed medical tourism, we've discussed entrepreneurship, we've discussed the digitalization of records and the importance of these various approaches. So thank you so much again, Dale, for joining us.
I'm glad to be here. Anytime you want me back, it's just a phone call away.
Thank you so much. You've been watching UWITV. Thank you for joining us.